This is Damian McNamara with Global Medical News Network, and I'm here at the American Society for Dermatologic Surgery joint meeting along with the American Society of Cosmetic Dermatology and Aesthetic Surgery meeting in Phoenix, Arizona. And with me is Dr. Wendy Roberts. Thank you for being with me.
Oh, you're welcome. Nice to be here, Damian.
I'd like to start off by, you're at this meeting, you're giving a session on how to get the most out of fillers in these kind of tough economic times, which I think is a really relevant topic. Can you give me some of the overall themes that came up at this morning's session?
Yeah, the themes, there were many themes, and it is a very relevant subject because the economy has affected everything, including cosmetic dermatology, where people don't want to, forsake their treatments, but they want to maximize or, what we said, optimize their results. A very nice part of the depressed economy is that, and I've seen that in my practice, that where else people used to look for the best deal and maybe go to non-core physicians, now the cosmetic practice really increases because people know that you're board certified, that you know what you're doing, and they're going to take their little bit of funds that they have allocated, they're going to come to see you versus risking going to see someone else. So we've actually seen a little increase in the people coming in for cosmetics into my practice, wow, although what they're spending is less.
Now, is there any danger associated with giving them a discount now when the economy's kind of down, and then eventually when the economy comes back up, maybe they're going to expect a certain price off the top, or is that a concern of yours at all?
That's an excellent question. I think it is a concern, and that's why I don't really advocate giving discounts, but I do advocate bundling of procedures.
Dr. Roberts, can you explain another take-home point?
I think the major take-home point from the talk was utilization of what I call the touch-up principle, which is based on the concept that when you fill a gas tank, to keep that tank full, it takes less product to keep it full. So we take that to the face. To fill a face, it takes maybe a little more product. But once you get your patient there and you get the face filled, it takes little to keep it there. So in economic times, it's an advantage for the patients to come in more frequently and put out a little bit of money for a treatment and keep their look.
Right. And how have your patients reacted to that?
They love it.
They do?
My patients they love it because, one, I'm being considerate of them, I'm thinking about their pocketbook, and I'm also thinking about how they want to look, and they like it because everyone can, afford maybe like a couple $100 for just a little something, and they appreciate it, and it works very well. So that was my major take-home point.
Okay, great. My last question is about your disclosures. Do you have anything related to fillers?
I'm a consultant for Sanofi Aventis Dermic, a consultant for Orthodermatologics, a consultant for Allergan, and I'm on the advisory board of Cosmetic Boot Camp.
Okay.
Also on the advisory board for La Roche-Posay.
Thank you for being with me. I appreciate it.
Oh, you're welcome. Thank you, Davey.
And this has been Damian McNamara, Global Medical News Network.